Hi everyone. Today we are going to discuss few exam questions related to principles of dialysis. So first question is, diffusion is the movement of option A, solute from an area of higher concentration to an area of lower concentration until equilibrium is reached. Option B, solute from an area of lower concentration to an area of higher concentration until equilibrium is reached. Option C, solvent from an area high concentration to an area of lower concentration until equilibrium is reached. Option D, solvent from an area of higher concentration to an area of lower concentration until equilibrium is reached. So this question is a direct questions. We already discussed about the definition of diffusion. So answer is option A. Diffusion is the movement of solute from an area of high concentration to an area of low concentration until equilibrium is reached. So second question is, solutions that have a higher osmolarity than body fluid are called hypotonic. Option B, hypertonic. Option C, isotonic. Option D, hypoosmolar. So for these questions we need an explanation. So let's discuss what is tonicity. Tonicity of a solution is its effect on the volume of a cell bathed in a solution. So what is isotonic solution? So isotonic solution, an isotonic solution has a concentration of impermeant solute equal to that of the cell, and so does not change the cell volume. So tonicity is talking about impermeant solute. So next is hypotonic solution. When a cell is bathed in a hypotonic solution, there is a lower concentration of impermeant solute extracellularly compared with high intracellular concentration of impermeable solute. This means there is a higher water concentration in the extracellular compartment, so all osmotic pressure will drive the water down into concentration gradient into the cell by osmosis. Therefore, the intracellular volume increases and cell swell and hemolysis will happen. So next is hypertonic solution. Hypertonic solution has a higher concentration of impermeable solute than that of the intracellular compartment. Bathing cell is in a hypertonic solution cause cell shrink because water leaves the cell by osmosis to enter by hypertonic environment. Thus, the intracellular volume decreases. So here we are want to remember one thing. In contrast to tonicity, the term used to describe the osmolarity of solution do not indicate whether or not the solute can permeate the cell membrane. So what is osmolarity and osmolality? So osmolarity is a total number of solute particle, that is osmol, in a liter of solvent. So there is osmolarity. So osmolality is a total number of solute particle, that is osmol, in a kilogram of solvent. So 1 osmol is equal to 1 mole of solute particles. So here what we understood, isotonic solution, both intracellular and extracellular concentration of impermeable solute are same. So there is no osmosis because like concentration gradient is not there and all equilibrium reached, so there is no net movement. So isotonic solution do not change the volume of cell. What will happen in a hypotonic solution? Hypotonic solution, the extracellular compartment is less solute, right, compared to intracellular compartment. So osmosis, the movement of solvent from the region of lower solute concentration to the region of higher solute concentration. So water will move from extracellular compartment to intracellular compartment. Hence, the cell will swell and last it will burst. So that will cause hemolysis. What will happen? Hypertonic solution. Hypertonic solution, the solute, impermeable solute is more in extracellularly compared to intracellular. So osmosis will occur from lower solute concentration to higher solute concentration. So water will move from the cell into extracellular compartment. Hence, the cell will shrink. So that will call crenation. So answer for the second question, solution that have higher osmolarity than body fluid are called hypertonic solution. Third question is, blood that is exposed to hypertonic solution may cause option A hemolysis, option B crenation, option C hypertension, option D hyperthermia. So here the explanation of the question we already discussed. So hypotonic solution, that means the impermeable solute is less in extracellular compartment compared to inside the cell. So what is osmosis? Osmosis is the movement of solvent from the region of lower solute concentration to the region of higher solute concentration. So here in hypotonic solution, solute is less in extracellular compartment compared inside the cell. So solvent or fluid will move from extracellular compartment to inside the cell. So cell will swell. What will happen in hypertonic solution? Hypertonic solution, concentration of solute, impermeable solute is very high in extracellular compartment comparing to inside the cell. So osmosis will occur from inside the cell to outside the cell. So cell will shrink. That will called crenation. In isotonic solution there is no net movement. It won't affect the cell membrane. So the answer for the third question is, blood that is exposed to hypertonic solution may cause crenation. So fourth question is, the principle underlying waste product removal process in hemodialysis is option A osmotic pressure, option B hydrostatic pressure, option C filtration, and option D is diffusion. So explanation for the fourth question is, so osmotic pressure we will see in osmosis. Osmosis is talking about solvent movement. Where we can see hydrostatic pressure. Hydrostatic pressure, the static pressure of the water. So there is a water movement. So filtration is talking about fluid removal. Diffusion is the movement of solute, right? So waste product is a solute. So we know we are talking about solute. Right answer for the fourth question is, the principle underlying waste product removal from process in hemodialysis is diffusion. So fifth question is, the removal of urea from a patient in hemodialysis is primarily due to the existence of option A osmotic pressure, option B hydrostatic pressure, option C electrical gradient, and option D is concentration gradient. So here is the explanation for the fifth question. Urea is a solute with a molecular weight of 60 Dalton. So solute movement is diffusion, and diffusion will occur based on the concentration gradient. What is diffusion? Diffusion is the movement of solute from an area of higher solute concentration to the region of lower solute concentration until the equilibrium reach. So we are talking about diffusion. So for the fifth question is, the removal of urea from the patient in hemodialysis is primarily due to the existence of concentration gradient. So sixth question, a hypotonic dialysate bath will cause option A hypernatremia, option B hypotension, option C vomiting, option D hemolysis. We already explained about this picture. So hypotonic solution, the impermeable solute are less in extracellular compartment compared to intracellular compartment. So fluid will move based on the osmosis from extracellular to intracellular, hence those blood cells will swell and it will burst. That will call hemolysis. Hemo means blood, lysis means splitting or separation. Answer for the sixth question is hypertonic dialysate bath will cause hemolysis. So seventh question is factors that influence the effectiveness of solute removal during hemodialysis are option A, solute size, permeability of the membrane and dialysate flow. Option B, temperature of the dialysate, blood flow rate. Option C, concentration gradient, fluid removal and clotting. So option D, all the above. Explanation of this question is factors affecting diffusion. So we already discussed this in the previous class. So factors affecting diffusion we can divide into two, by the nature of the solution and by the nature of the membrane. So what is there in the nature of the solution? There is a concentration gradient. Higher the concentration, more diffusion. Molecular weight of the solute, lower the molecular weight of the solute, diffusion is faster. And what is the temperature? Temperature, the higher the temperature, more the diffusion. And factors affecting diffusion by the nature of the membrane. First one is permeability of the membrane. So high permeable membrane and with more pores will cause more diffusion. Surface area of the membrane. Surface area of the membrane means a big membrane that can accommodate larger pores and more pores, so diffusion is faster. Flow geometry we already discussed. We have two flow geometry based on the blood and dialysate. So counter current and co-current. Counter current is opposite direction. Blood and dialysate will pass opposite directions and co-current is the same direction. So counter current flow will enhance diffusion fast. So answer for the seventh question is factors that influence effectiveness of the solute removal during hemodialysis are it will affect the solute size, permeability of the membrane, dialysate flow, temperature and blood flow rate, concentration gradient, fluid removal and clotting. So the correct answer is all of the above. The eighth question is water moves across a membrane from an area of lower solute concentration to an area of higher solute concentration by which principle? Option A, diffusion. Option B, filtration. Option C, osmosis. Option D, ultrafiltration. So this is a direct questions. So water moves across membrane from an area of lower solute concentration to an area of higher solute concentration by osmosis. So the theory we already discussed in the previous class. You can go through that. Ninth question is the movement of fluid from the tissue towards a high concentration of sodium in the blood is an example of option A, diffusion, option B, filtration, or option C, osmosis, option D, ultrafiltration. These are also direct questions. Where is the movement of solvent? We call osmosis. Diffusion is talking about solute. Osmosis talking about fluid. So this indirectly we are explaining osmosis, the movement of solvent from the region of lower solute concentration to the region of higher solute concentration. So the right answer is option C, osmosis. So 10th question is which of the following actions would increase diffusion during dialysis? Option A, decreasing the ultrafiltration rate. Option B, giving more saline in the treatment. Option C, giving erythropoietin to enhance the hematocrit. Option D, using a bath that will provide a greater concentration gradient. So this is direct questions. So is factors affecting diffusions. You can go through our theory class, the last section. So direct questions. Which of the following factors will increase the diffusion during dialysis? Option D, using a bath that will provide a greater concentration gradient. Question number 11. A solution is a mixture of A, water and blood, B, dialysate, C, a solvent and solute, Option D, water and sodium. This is also a direct questions from theory class. So solution is the mixture of solvent and solute. Option C, solvent and solute. So water and blood, no. And dialysis is an example of solution. In dialysis, water is solvent. Electrolyte like sodium, potassium, calcium and all is a solute. Water in sodium, that is salt water, is also an example for solution. Question number 12. A semi-permeable membrane is a filter that option A, allow only certain size of particles to cross. Option B, prevent fungal contamination. Option C, can distinguish between particles. Option D, incompatible, non-toxic and hypoallergic. So answer is a direct answer because we already discussed in theory class. So semi-permeable membrane is a filter that allow only a certain size particle to cross. Number 13. During dialysis, ultrafiltration occurs when option A, water is removed from blood because there is a pressure gradient across the membrane. Option B, phosphorus is removed from blood because dialysis is low on phosphorus. Option C, a higher concentration sodium causes water to move from a body compartment to a dialysate. Option D, a suction device is applied to venous trap and Howard clamps is applied to the arterial side of the blood set. So answer for the question 13 is also a direct question. So by definition of ultrafiltration, we can see during dialysis, ultrafiltration occurs when water is removed from blood because there is a pressure gradient across the membrane. Phosphorus and sodium handled by diffusion, not by ultrafiltration. So question 14. Which of the following factors that the rate of diffusion? So option A, pressure gradient. Option B, flow rate. Option C, hydraulic pressure. Option D, surface area of the membrane. So explanation for the 14th question is pressure gradient is osmotic pressure, as we can see in osmosis. So flow rate is ultrafiltration, is a solvent drags, so it we can see in both ultrafiltration and convection. Hydraulic pressure is based on hydraulic pressure is ultrafiltration, high hydraulic pressure to lower hydraulic pressure. And surface area of a membrane is the factors affecting diffusion. So more the surface area, more pores, more diffusion. So answer for the 14th questions, which of the following factors affect the rate of diffusion, is option D, surface area of the membrane. 15th question, dialysate is a fluid that helps to remove waste product from the body. It contains a number of substances. Choose the group below that might be prescribed for a dialysis solution. Option A, bicarbonate, sodium, potassium. Option B, magnesium, creatinine and calcium. Option C, chloride, glucose, urea. Option D, beta-2 microglobulin, calcium and sodium. Here the composition of dialysate fluid. So in dialysate we have sodium, potassium, chloride, bicarbonate, acetate, citrate, calcium, magnesium, glucose. In option B, they given creatinine. Creatinine you can see in dialysate. And in option C, they mention urea. Urea also is not there in the dialysate. And in option D, they mentions beta-2 microglobulin. This is a middle molecule toxins. So these are all not in dialysate. So the right answer for the 15th question is dialysate composition is option A, bicarbonate, sodium and potassium. Thank you for watching. Stay tuned. More points we'll discuss on next episode.